During the EMN 21 Congress, the second one, we have submitted 2 abstracts from Ankara University. One of these is on our experience with COVID-19 infection. And a year ago, when the COVID-19 pandemic broke out, we were quite at a loss because there was not much experience regarding such widespread infection and approach to myeloma patients. And during this year and during the follow-up, experience accumulated and recommendations started to appear. And the recommendations was such that myeloma is more dangerous and that we should continue anti-myeloma treatment, although it may predispose patients to cytopenias and hypogammaglobulinemia, which may increase the morbidity and also the severity of viral infection. So between the last months and especially during the last 6 months, the COVID-19 experience among our myeloma population started to increase. And during the search, we came to diagnose 48 patients who presented with COVID-19. And among these patients, about half of these were on lenalidomide maintenance already because they required treatment or because of the clinical trials that they were subjected to. And the other patients were not on lenalidomide when at the time of COVID-19 infection. And we had an additional 21 patients who were on lenalidomide maintenance but did not acquire COVID-19 infection. Thus, we were able to compare the cytopenias, lymphocytopenia, their characteristics which are used for the scoring system for infectious morbidity for myeloma patients. And we compared the results in our poster, and this poster showed that the median age of patients who were on lenalidomide versus those who were not on lenalidomide when they developed COVID-19 showed that the off maintenance COVID-19 patients were elderly, 61 versus 66 of median, but their response status were similar. And on the other hand, the neutropenia, lymphocytopenia, and immunoparesis status was in favor of patients who were off lenalidomide, so they were less susceptible to a viral infection. But however, when we looked at the COVID-19 infection outcome parameters such as severity of infection, patients who were not on lenalidomide maintenance had more severe disease, which is 44% compared to 26% in those who were not on lenalidomide. And furthermore, the infection fatality rate was also higher as expected because of the severity of COVID-19 among patients who were on lenalidomide. Thus, we can conclude that continuing lenalidomide maintenance does not predispose patients to severe infection and higher mortality, despite the fact that they might have deeper neutropenia and lymphocytopenia and immunoparesis. But age and other comorbidities are more important in terms of the severity of COVID-19. And finally, I would like to thank the EMN for selecting this poster as under age 40 the best abstract. And so on behalf of our fellows Ekin and Güldane, who contributed to this study, I'm very happy to be able to present this data to you.